Hello, Paul Ryan Kelly here. I'm discussing Abilfy Maintena. It is a reimbursable item. See there, it's updated the 30th December 2014, and it costs the NHS maybe a whole arm and a leg. But in Ireland, we've got it. Look at the price: 348.51 cents, €348 and 51 cents. Code the number of packs to be dispensed. Abilfy Maintena and prolonged solvent for injection. Why this one? After 13 years in psychiatry, why this? Well, it's easy. Here is the study. I'll read this to you. Aripiprazole once monthly shows superior effectiveness to paliperidone palmitate once monthly on quality of life scale in patients with schizophrenia. Previous releases, next releases. Head-to-head qualified study compared the effectiveness of aripiprazole once monthly to paliperidone palmitate once monthly in adult patients with schizophrenia. Patients treated with aripiprazole once monthly demonstrated a statistically significant improvement on the primary endpoint quality of life measure compared to those who treated with paliperidone palmitate. Discontinuations due to adverse events occurred in 10.8% of patients in aripiprazole once monthly group compared to 18.4% of patients in the paliperidone once monthly group. Valby, Denmark, Princeton, NJ, US, 3rd November 2014. H. Lundbeck, AS Lundbeck, and Otsuka, America Pharmaceutical. Otsuka today announces results from Qualify study, the first study of its kind comparing two atypical long-acting injectables antipsychotic therapies in close to real-life settings. The effectiveness of aripiprazole extended release injectable suspended for intramuscular use. Abilfy Maintena registered, and paliperidone palmitate once monthly. Paliperidone palmitate extended release injectable suspension for intramuscular use. In adult patients with schizophrenia was measured by the Heinrichs Carpenter Quality Life Scale, QLS, the primary endpoint. The QLS is a clinician-related scale designed to evaluate social functioning and behavior in patients with schizophrenia. The QLS is one of the most commonly used quality of life scales in schizophrenia clinical trials. The four domains of QLS evaluate the patient's intrapsychic foundations: sense of purpose, motivation, emotional interaction, etc. Interpersonal relations, social activity, social network, etc. Instrumental role, work functioning, work satisfaction, etc. The common objectives and activities. Higher scores indicate better quality of life. Additional secondary assessments include the clinical global impression scale, CGI, which measures symptom severity with treatment response, the investigator assessment questionnaire designed to evaluate the response to antipsychotics, the subjective well-being under neuroleptic scales, short version, SWSS, a self-rating scale for patients on antipsychotic drugs. In a 28-week trial, patients treated with aripiprazole once monthly demonstrated statistically significant improvement in the QLS total score compared to patients treated with paliperidone palmitate once monthly. The mean difference between the treatments of change from baseline to 28 weeks in QLS total score was 4.4 bracket p equals 0.031 close bracket, with the respective change of 7.5 for the aripiprazole once monthly group and 3.1 for the paliperidone once monthly group. A difference between treatments was confirmed in the clinical global impression severity scale, CGIS, used by clinicians to evaluate the serious illness patients from baseline to 28 weeks of treatment. Bracket p equals 0.004 close bracket. Those treatments were generally well tolerated. However, discontinuation rates due to adverse events were 10.8% bracket n equals 16 forward slash 148 versus 18.4% bracket n equals 27 forward slash 147 comma for aripiprazole once monthly group versus paliperidone once monthly group respectively. About Qualify study. Qualify is a randomized open-label rater-blinded head-to-head comparison of intramuscular aripiprazole once monthly 400-300 a month and intramuscular paliperidone injection 50 to 150 milligrams a month or 78 to 234 milligrams a month USA and Canada close bracket open bracket over 28 weeks. The study was designed as a non-inferiority study, allowing for subsequent superiority testing. If non-inferiority criterion was met, a minimum of 3 weeks oral conversion period where patients received oral aripiprazole or oral paliperidone. The intramuscular formulations were administered according to prescribing information for 5 weeks and continued for 20 weeks. The primary endpoint was acute less change from baseline to 28 weeks. The study randomized 295 patients in Europe and in North America was 281 received study treatment. The study design presented at the new clinical evaluation NCDEU 23RD annual meeting in 2013. Data from qualified study will be presented at upcoming medical congress and scientific publications. About Abilfy Maintena once monthly. Patients stabilized oral aripiprazole. Furthermore, it's available in the US for treatment of schizophrenia. In Canada, it's available for maintenance treatment of schizophrenia. Stabilized adult patients in Australia for maintenance of clinical improvement and treatment of schizophrenia. About schizophrenia. Schizophrenia is a disease characterized by distortion in the process of thinking and emotional responsiveness. It commonly manifests as hallucinations, paranoia, bizarre delusions, disorganized speech and thinking, and is accompanied by significant social or occupational dysfunction. Onset of symptoms typically occurs in young adulthood, and condition is chronic, often requiring lifelong treatment to mitigate symptoms. It has been estimated that schizophrenia affects approximately 1% of the population in the US and approximately 24 million people worldwide. In the US, there's probably 2.4 million adults with schizophrenia prevalent equally in both genders. While there's no cure for the disease, symptoms and risks of relapse, the emergence of worsening psychotic symptoms can be managed with patients with aripiprazole and antipsychotic treatments. Otsuka contacts. Media. Rose Weldon, Otsuka Pharmaceuticals Inc. Rose.Weldon at otsuka-us.com. Number 1-609-524-689. That's an international code. There's investors Yoko Ishii, investors Palihon Olsen, media Mads Kronberg, director media relations, Jens Hoyer, Ashley Nicole Deutschen. About Asuka America Pharmaceuticals. Asuka America Pharmaceuticals Inc. is a OAPI, is an innovative, fast-growing healthcare company that commercializes Otsuka discovered in-licensed products in the US with a strong focus on neuroscience, oncology, cardiorenal, and medical devices. For information, visit http://www.otsuka-us.com. OPAPI is a subsidiary of Asuka America Inc. OAI is a holding company established in the US in 1989. OAI is wholly owned by Otsuka Pharmaceutical based in Japan. Otsuka Group employs approximately 42,000 people globally, and the products are available in more than 80 countries worldwide. Otsuka welcomes you to visit its global website. Well, okay, my opinion and analysis. No one wants schizophrenia. If you have it, I've tried both intramuscular injections. I agree with the study. Aripiprazole is a superior medication and will significantly improve your life. However, for some clients, patients, whatever you want to call them, you will have maybe better success with micronutrients because HIV/AIDS is worsened, especially with dementia, by aripiprazole. So read the label. Diabetes is worsened with aripiprazole. Sorry, I didn't mean that. Aripiprazole is worsening AIDS and diabetes because of the with some people. Um, all right. In my case, everyone's different. In my case, I would go for the injection. I have pancreatitis cancer. Um, Otsuka's making a new cancer drug with nanotechnology. Thank them for their work. And I hope that brexpiprazole, the successor to aripiprazole, comes out in a once monthly injection and that it is demonstrably superior to aripiprazole. That's what we're all hoping for, and that would be great. So thank you, Otsuka, and thank you to all those who work in the medical industry.